Welcome to PBNP, also known as the Peanut Butter and Progress Podcast. My name is Austin.
And I'm Kayla.
We're a normal couple with an abnormal passion for health and fitness.
With over 25 years of combined competitive sports experience, we hope to share our knowledge with you and make your health and fitness journey just a little easier.
Thanks for joining.
And we're back again, episode 3 with the Peanut Butter and Progress Podcast. Today, we will be doing something a little bit different, not that we even have any sort of normality or structure established at this point.
Zero structure, zero routine.
But today we're going to be interviewing Kayla. And specifically, we're going to be talking about invisible illnesses and Ehlers Danlos Syndrome. So essentially, why is important. We always talk about why you might want to listen to this podcast, who this might pertain to. And I can kind of come up with 3 general populations who would find this episode useful for them. Number 1, if you are interested in health and fitness, which I think you might be because you clicked on this episode, I think you will find Kayla's story very fascinating. Anyone who's into health, fitness, genetics, those types of things will probably find this conversation very, very, very interesting. I encourage you to stick around if that pertains to you. Number 2, if you are suffering from an invisible illness or some sort of disability that affects your daily life, I really, really, truly think that you'll find Kayla's story very inspiring. And I think she'll also be able to help you with certain ways that she's been able to not just cope with her disabilities, but also excel in life. It's actually a pretty incredible story, and I'm excited to talk about it. And number 3, if neither one of those first 2 populations pertain to you, I think that we all have a small but significant moral obligation to get to understand those with disabilities. Prior to meeting Kayla, I will say I had almost no knowledge of what it means to have a disability, and I did not realize what that means for that person's everyday life. And I certainly did not understand that there's disabilities that are not quite apparent to the naked eye. And I really, really do encourage everyone to stick around to get to understand Kayla, because I think it's all going to make us better human beings at the end of the conversation. So without further ado, Kayla, welcome to your own podcast.
Wait, who? Must have been one of your other girlfriends. I swear I could talk.
I'm surprised I even got through the intro with no assistance to my brain today. I actually had carbs about 30 minutes ago for the first time in 2.5 days, so that's exciting.
Oh, it's been great.
Here we are. So how's life treating you right now?
I surprisingly feel better on this prep than I thought I would. We are 13 weeks into prep now, still 5 weeks to go. And I will say I was very nervous about prepping. This is my first prep since I've been diagnosed with Ehlers Danlos Syndrome.
And how long ago was that?
I was diagnosed in May of 2021. So it hasn't been that long, but because it is a genetic condition, I have had it my entire life. And a lot of issues that I had growing up started making a lot of sense once I got diagnosed. And one of the issues that I have noticed recently has been muscle shakes. I've had really easy muscle fatigue that causes tremors. And for me, the scariest decision in deciding to step on stage was I was terrified on show day that I would get up on stage. And I know that a lot of people shake when they're flexing really hard on stage, but I was worried that my tremors would be so noticeable that I would be judged and scored poorly for it. Luckily, they've improved. But obviously, prepping with Ehlers Danlos is not easy for so many reasons.
Yes. And so I guess for someone who is new to EDS, in like 1 to 2 sentences, how would you best describe that disorder?
So there are 13 different subtypes of Ehlers Danlos syndrome. I have the hypermobility type. Ehlers Danlos is a inherited genetic condition. There is a very small chance that it can spontaneously occur through a random mutation, but is less likely. It's more likely that you inherited it from your parents. But it is a genetic condition where your body produces defective collagen. And so if you think of a normal person's collagen fibers, they're very tightly wound together.
And collagen is a structural protein, correct?
It is.
And it's part of your entire body.
It is.
Your head, your hair, your eyes, your skin, your intestines, your bones, your muscles. Yep. Collagen is present in all of these things, right?
It's present throughout your body. And so defective collagen is absolutely a problem throughout almost every single system within your body. And so in people that have defective collagen types, if you actually look at it under a microscope, where I mentioned other people's are very tight, if you look at someone who has Ehlers Danlos Syndrome, their collagen underneath a microscope, it's so loose. And so what you will see in people that have Ehlers Danlos Syndrome is we are overly flexible. And I know that sounds fun until you continuously dislocate joints. So you'll notice people with Ehlers Danlos Syndrome, a lot of times, especially when you're growing up as a kid, I would continuously roll ankles, and not to a point where, like a normal amount that people experience. It was like every single day on flat ground.
Every day.
Every single day. And again, none of it made sense. I think probably around middle school, I started breaking out in hives for no reason. No one could figure it out. It didn't happen all that often. When I was around 5, I dislocated the same elbow over and over again. So much so that the doctors actually just taught my mom and dad how to pop it back in so that we didn't have to go to the emergency room every time it happened. There were so many signs that I had Ehlers Danlos Syndrome, but I was not diagnosed until I was 27. So that's a long time to go through your life, kind of knowing that you're not normal, but also not having a disability that is so visible that it's easily diagnosed. I think I read a statistic somewhere where it takes the average person with Ehlers Danlos Syndrome somewhere between like 15 to 30 years to get diagnosed. It has the longest diagnosis time of any disability.
It's fascinating, one, that they even have that number available. You know what I mean? Because that certainly speaks to the fact that this is not an easily recognized diagnosis, right?
It's not. And when they talk about Ehlers Danlos Syndrome, you'll often hear to people with rare conditions referred to as zebras. And it's because in the medical community, doctors are always taught to look for the obvious condition. They're looking for the horse. When you roll your ankle, it's probably just because you stepped on it wrong. They're looking for the horse. That's your rolled ankle. They're not looking for the zebra, the quieter hoofbeats that you might not exactly hear loud and clear. And in someone who that's repeatedly happening to, there's probably an underlying issue going on, and that is the person with a rare condition. But you kind of have to wait, unfortunately, to get a lot of these symptoms throughout your lifetime before you're diagnosed.
And that's really no fault of the doctors, right?
No.
I think it makes sense that they should be looking for obvious illnesses.
It does.
Right?
Yeah, because there are a lot of people who will come into a doctor's office and be like self-diagnosing, and I think there's a lot wrong with me, and there might not be. And so a doctor is just honestly trying to do their job, because they can't go around just diagnosing everyone with rare conditions, because the likelihood of people having those rare conditions it's very uncommon. But when someone does actually come in with these conditions, unfortunately, it can take a really long time to get diagnosed, because who would ever look at dislocating joints and continuous chronic hives and say, oh, I know exactly what that condition is? You don't, when it's not something you come across frequently.
Right. Because there's, an infinite number of things that could cause hives or dislocating joints. But to recognize the two and notice that there might be an underlying common factor is probably very difficult to do.
It's extremely rare. And so, like I said, it took me 27 years of life just knowing that something wasn't right with my body. But I didn't know what it was, and doctors didn't know what it was. And
as a kid, besides the hives, you got hives as a teenager, and you rolled your ankles as a kid, and you noticed that you were hypermobile, which is kind of also something that's hard to define. Did you have any other symptoms?
Outside of dislocating joints and stuff like that, another thing that I didn't put together until I started reading, there's a book that I'll link in the description of this video. It's called Disjointed. It actually has a bunch of medical studies and so much information on Ehlers Danlos Syndrome. If you've been recently diagnosed, it's something that I would highly recommend reading. But one thing that I didn't put together until I read that book was there was one mom who was describing her daughter's fatigue. And she said, I have such a hard time getting my daughter out of bed in the morning. It's nearly impossible to get her out of bed. Once she's out of bed, it's fine, but it's really hard to get her to wake up. And I catch her zoning out a lot. And I had not put that together until Ehlers Danlos Syndrome has quite a few comorbidities that normally come along with it because it does affect so many systems in your body. So I also have a form of dysautonomia, which is a disorder of your, I can't even say this word ever, autonomic.
Which one?
Nervous system, autonomic nervous system,
Sure.
autonomic. I don't know how
Autonomic?
to say it. Yeah.
Okay.
Is that it?
Probably.
I don't know.
Automatic.
Your automatic nervous system, not your central nervous system. But they are disorders that there is poor communication a lot of times between your heart and your nervous system. And so like bodily functions that you don't control, like breathing, heart rate, respiratory rate, that kind of stuff that your body.
Those are symptoms you've experienced as an adult, right?
They are. And so I was diagnosed with vasovagal syncope, which like if you can have like the best form of dysautonomia to have, it would be that one. It's typically the least.
It's the least sucky.
It's the least sucky out of all of them. So essentially what happens is if you're doing something like standing up in one place for too long, your body sends a faulty signal and essentially says, oh, drop the heart rate, drop the blood pressure. And so that's typically what will cause you to black out.
Yeah. And you are super prone to fainting, right?
Very prone to fainting. So as a kid, when you have dysautonomia, one of the first signs is zoning out. I didn't know that growing up. I could not focus to save my life in school as a kid. And I would sit there in class and not realize that 10 minutes had passed and I hadn't paid attention to what happened.
Interesting. And, you know, this is going to really ignite a conversation, but it's interesting you say the fact that you have a hard time paying attention and you're constantly zoning out. But I know for a fact you've been a straight A student your entire life. You have multiple college degrees. You're currently working on your second master's and you have intentions of earning a doctorate at some point, right? But someone who's looking from the outside probably says, oh, this girl's a straight A student. She loves going to school. She probably has no problems paying attention. But really, truly, you're telling me that you've always had problems.
I have always had problems with it. I have always been the kind of student, and again, this is because I zone out so easily in class. I don't learn a single thing sitting through a lecture. So I have a bachelor's in biology, which we've mentioned before, and I would go to one of my biology classes and I would sit through an entire lecture realizing that I didn't pay attention at all, not on purpose. I would literally sit there and I would be staring at the professor, but I would be completely zoned out. And I know you can tell when it's happening to me. Yeah. I just it's like my brain disconnects from my eyes and I'm just staring and I'm in my head thinking about something, but I can't physically pay attention. And I would have to leave class and go back and read the textbook or read what I wrote because I can disconnect my brain and still write all of my notes. But unfortunately for me, I never learned a single thing sitting in a lecture. And it's the same way as an adult too. I would go to briefs and meetings in the Army and I would walk out not knowing what had just happened. And I would have to physically go read through the notes that I had taken and see what was actually said. So I just learned for myself what I needed to do because I can't pay attention in class. And that was turn the brain off, take notes, and then read it later. Yeah. Go read the textbook later. Unfortunately, that's just been the reality for me.
Interesting. And so similar to the circumstance where you're a high-performing student, but you claim to have trouble paying attention, similarly, you look amazing and you put so much time and energy into the gym and you look like an absolute fitness freak, but you face a long list of disabilities that limit your ability to perform and be in the gym and stay fit, right? But what happens is essentially people see this fit person and they struggle to recognize that they possess a disability, right?
Yeah, there's times where I love social media because it can connect you with people that are just like you. I've made so many friends that compete in bodybuilding competitions, and I've made so many friends that also have Ehlers Danlos Syndrome. And it's just unfortunate because, social media can be used to paint a picture that we want everyone to see. A lot of people see me looking relatively healthy, but behind the scenes, they don't know that I'm having back injections and nerve ablations every other week for the last 6 months. They don't know that I've had 2 SI joint fusions that didn't fuse and I haven't recovered from. They don't know what it's like to go to the gym and have such bad muscle tremors that even like trying to stand up on your own is so shaky, or what it's like to feel like you're going to pass out on a piece of cardio equipment and you need to choose one that has handles. And a lot of times when I share these things on social media, it's met with so much support. Mm-hmm. But I've also had a lot of times where I share things on social media and I have people come on there and tell me I'm not disabled enough, which is really unfortunate. You know, I'll post a photo or a video trying to encourage people, showing what it's like to recover from a back fusion. And I'll have someone comment, well, you can't be that disabled if you're in the gym.
Which makes no sense. No sense.
It doesn't, because we know, at least you and I know, other people with physical disabilities know that really the only way to try to improve your body and improve your life is physical therapy, to be in the gym.
It's like their logic is you have to be fit in order to earn your right to go to the gym. Whereas it's those who are not fit or face disabilities are the ones that need to be in the gym in order to improve their lives.
And it's like, it's that logic to me that doesn't make sense, because if I'm recovering from, like when I recovered from my back fusions, you will get put in physical therapy.
Oh, yeah.
To try to help your body heal, to try to get the same mobility that you had back. So how can you go to physical therapy and that be prescribed as a part of your recovery, but you can't be in the gym still trying to lift weights?
Yeah.
And another thing that I think I've done a poor job of sharing on social media is how I have modified my workouts since having my back fusions.
Yeah. I think the average viewer would say, I see fit girl working out, she must be healthy. They don't take into account where you've been versus where you are and where you're going, and why you're choosing cable exercises and machine exercises over the barbell. When's the last time you touched a barbell? You just don't, right?
I don't. And that's, you know, that's one of those things is like, I'm not really doing anything different than I would do in physical therapy. I'm just changing some of the weights and some of the reps to turn it a little bit more into a bodybuilding workout versus an endurance type of workout, which is a lot of times what you're doing in physical therapy. You're doing usually a little bit more lightweight, high rep. I just turn it into more of a hypertrophy training workout, meaning essentially you're stimulating the most muscle growth possible. And so that's what I've been doing. Even throughout this entire prep, I'm trying to show people that you can still bodybuild and not be able to barbell squat or barbell deadlift, because I can't do either of those things.
Yeah, it's amazing. I know you've always been a fan of isolation movements, and that's really been key for your success as a bodybuilder. When we first met, I was a power lifter and I did nothing, absolutely nothing but barbell movements. Every variation of squat, bench, deadlift you could come up with, like that was my specialty. And it wasn't until I really started to gravitate away from the barbell and towards those isolation exercises that I really started to gain traction as a bodybuilder. It's just funny that I had to have that own experience for me before figuring things out. But you have figured it out through a different pathway.
Yeah. And that's one of the biggest pieces of advice that I would give to someone that has Ehlers Danlos or has recently been diagnosed or has just had a surgery or something like that. You don't have to give up on fitness. You just kind of have to find your new normal. And for me, a new normal, unfortunately, or fortunately, I guess, meant not being able to do the heavy exercises that cause me so much pain, like a heavy barbell back squat that just continuously hurts my back because, like I mentioned, my fusions didn't fuse.
To be clear, in the last 2 years, you've had 2 failed back fusions, right?
Yes.
You've had 2 spine ablations, nerve ablations in your spine.
Yes.
And how many injections have you had in those 2 years?
I've had over 20 injections into my spine and slipped a disc last year too.
Yeah.
That sucked.
Yeah.
I honestly would say the slip disc is worse than the back fusions, but it has completely changed fitness for me, where it used to seem a little bit easier for me to push through some of the pain and the hard times. It's become almost impossible to push through pain. And I don't mean that when I'm having a painful day that I don't go to the gym.
Right.
I go to the gym and I train a different body part. If my back's hurting, it's an upper body day now. It doesn't mean that I have to completely give up on the things that I enjoy doing. But like I said, it just means that it takes a lot of modification. And
you just do what you can, right?
You do what you can. Doing something's better than doing nothing, as we say.
100%. Doing something is always better than doing nothing. And I think that, you know, the lesson that you just taught us could apply to so many people, even if you don't have a disability. Say you're sick, right? you're not going to get the best workout of your life in, but you can do something. Something is better than nothing. If you're recovering from an injury, maybe you just had shoulder surgery, you're not going to be doing any pressing anytime soon, but there's the other half of your body that you could be working on.
Exactly.
If you're on vacation, right? You're not going to get the best workout of your life, but at the end of the day, something is always better than nothing.
Yeah, that's very true. Something is always better than nothing.
So when talking about the road to diagnosis, how long was it from when you first started going to doctors and being like, hey, there's something wrong here, and I think it all has something in common, and to the point where finally someone said, hey, have you heard of this EDS thing?
It wasn't until I was in the Army. I would like to think that I have been very fortunate in how EDS has progressed in my body. I've always been overly flexible to the point where I roll joints. I've dislocated joints pretty frequently, but I've gotten through most of my life without it being debilitating for me. And I feel very fortunate for that. But it was when I joined the Army. In the Army, you're doing a lot of running, which I wasn't doing before I joined the Army. It was a lot of rucking with
high impact,
heavy weight on your back. And it was during those times where I just started noticing that my back just didn't feel quite right. And it progressively got worse and worse. I think it was probably in early 2019, maybe 2018, I started having really bad low back pain. And I was like, it just must be from my training intensity. I'm sure it'll go away. And it didn't. It persisted. And I was like, okay, maybe this isn't from training. And I would go to doctors and they'd be like, your bones look fine on an x-ray. I'd have MRIs and they'd be like, your ligaments look fine.
Of course they do.
Yeah, because the problem is that they're too loose. It's not that there's a tear. It's not that I have a broken bone or anything like that. It's
everything's connected the way it's supposed to be.
Yep, it's that my ligaments are loose, but nothing. And then I started breaking out in hives repeatedly in the fall of, I think, 2019. And my hives, my doctor diagnosed me with chronic idiopathic hives, and they would last for 6 to 8 weeks at a time. And I can't tell you how miserable it is to be covered in hives for 6 to 8 weeks and no medication you're taking is helping. And in individuals with EDS, it's typically more of an issue with your own histamine cells. It's essentially an autoimmune condition where your body is attacking itself and producing just way too much histamine. And so you have to block both of your histamine pathways to get it to stop, which we eventually figured out and got it under control. And I PCS'd to a different unit, a different duty station, and had to start all over with new doctors. And same thing, I would go in and I would be like, I am in so much pain. My back hurts so bad because the new unit that I went to actually rucked more than the previous units that I did. And it just kept getting worse. And if I would step wrong, I would get this searing pain, almost like something in my back had just kind of like slipped out of place just a little bit. And it was excruciating. And it was at that point that they referred me to an orthopedic surgeon who also didn't see anything wrong. But I had asked at one point because I was so fed up. I was trying to research. This had been going on for like 3 years now. And so I was trying to research, what could this possibly be? And when I was looking up SI joint dysfunction, two of the main causes of pain in your SI joint are pregnancy.
Okay.
Well, I'm not pregnant.
Me neither.
Thank God. And connective tissue disorders.
Okay.
So
Which there are many of, right?
There are many. I can't even tell you how many. And I went back into that orthopedic surgeon, and when he read me the results of my CAT scan, he was like, I don't see anything structurally wrong. I asked him, is there any chance that I could have a connective tissue disorder? And he was like, that's actually a possibility, but I can't diagnose you. Go back to your primary care. So I went back to my primary care, and I had gone in and I was like, is there the potential that I could have a connective tissue disorder? I was not trying to self-diagnose in any way. I had not picked out a random connective tissue disorder and been like, is this the one? Do I have this one? I had just gone in, and because when I had started researching connective tissue disorders, I could perform all of the tests. There are hypermobility tests that you can go through. All of my joints are hypermobile. And then there were certain other things like family history. Does this happen to your family members? And then there's a whole list that you can go down, even like how stretchy your skin is. Do your scars form a certain type of way? It's a very strict diagnosis to get diagnosed with Ehlers Danlos Syndrome. And I had gone in, and the doctor was like, at first he was like, no, there's no way you'd be hypermobile in all your joints. And I was like, I can run through the Beighton scale for you.
Okay.
And he was like, I now see that all of your joints are actually hypermobile. And he was like, I need to go do some research before I can make any decision on what's going on here.
You said Beighton?
Yes.
And that's like what, a list of hypermobile tests?
It is. So you can go through and the first one is like, if your thumb is hypermobile this way, if you can bend your pinky back like past 90 degrees, if, when you bend your elbow here, you've got a little bit of hyperextension. It goes through almost, I don't want to say every major joint in your body, but it goes through a lot of major joints.
So this is potentially like an at-home test someone could do on themselves and then use as for a first step.
You could try it on yourself and then ask your doctor to actually perform it on you. Just to kind of see if it's potentially something you should ask your doctor about. And I left his office and I was actually driving home, and he called me and he said, I know exactly what you have. And I was like, okay, what's that? And he said, you have Ehlers Danlos Syndrome. He said, looking at all of the conditions that you have, they all seem so not connected. But when you look at them in the scope of Ehlers Danlos Syndrome, it is very common for people to have stomach issues. It is very common for people to have allergy issues. He was like, your hives are actually an indication that you have Ehlers Danlos Syndrome. The dislocating joints, anxiety. I know a lot of those things are seem like they're separate, but in people with Ehlers Danlos, those are all can be part of your diagnosis. And he was like, everything makes sense now. And he was like, when you were a kid, did you have problems dislocating things? And I was like, yeah, I would dislocate major joints all the time and have to go to the doctor and have them popped back in. And then from there, I got referred to multiple different specialists, an allergist. I got referred to a cardiologist, which is how I got diagnosed with vasovagal syncope. And ever since then, it's just kind of been a whirlwind of specialists and diagnoses and surgeries. And
so was the primary care manager able to formally diagnose you himself, or did you have to see a geneticist first?
I did see a geneticist. Technically, your primary care can diagnose you. So of the 13 subtypes of Ehlers Danlos Syndrome, the hypermobility type is the only one they have not isolated the gene for. So if they perform a genetic test, all they can do is rule out the other types of Ehlers Danlos Syndrome, which are the other types, especially when you're looking at the subtypes like the vascular type of Ehlers Danlos Syndrome, that is concurrent with a reduced life expectancy. Unfortunately, a lot of patients with the vascular type don't usually live very late into their 40s, which is very sad. And so they have to test for those types because those ones you have to monitor very closely. But the hypermobility type it is mostly relatively benign. I mean, it does suck and it can be very debilitating. There are patients with hypermobility Ehlers Danlos who are wheelchair bound. It can be debilitating, but it is usually not life-threatening, which is a relief to anyone who's just finding out that they're diagnosed with it. I just want you to know that it does suck, but it is usually not life-threatening.
Okay, super interesting. So for someone who thinks that this scenario might apply to them, would you recommend that they go straight to their primary care, or would you recommend that they reach out to a geneticist and try to accelerate the process?
Well, typically you're going to have to be referred to a geneticist. So it's normally best to go through your primary care, and they can also kind of be that buffer, because if everyone who thought they had Ehlers Danlos reached out to a geneticist, a lot of people are going to go there and a geneticist is going to be like, why are you wasting my time? You don't have Ehlers Danlos syndrome. You know what I mean?
Okay.
So I would for sure recommend going to a primary care because they're also probably just going to have to put in a referral for it. And unfortunately, a lot of primary care won't if you get diagnosed with a hypermobility type because there is not a genetic test right now that can confirm it. There is a lab, the Medical University of South Carolina believes that they have isolated the gene, but there's not testing available. You know, they're kind of in like clinical trials right now. I've actually submitted my DNA there so that they can test it, so that they can confirm whether or not they've isolated it. They asked for people with who have a clinical diagnosis of Ehlers Danlos syndrome to send it in. So one thing that I guess I want to address kind of here at the end is I didn't know this. You were actually the first one who brought it to my attention, but apparently there's like a trend of people pretending that they have Ehlers Danlos on the internet. And I didn't know that was a thing. And that's really unfortunate because for people that do have Ehlers Danlos syndrome, it sucks that there's people out there that are kind of like tarnishing it. And to be diagnosed with Ehlers Danlos syndrome, there is a criteria. You can find it on Ehlers, I think it's the Ehlers Danlos Society website.
Okay.
It's very strict. The diagnosis, like to be currently diagnosed, you have to fill out that form. And a doctor has to sign off that form for you to be able to say, I have Ehlers Danlos syndrome.
Okay.
Or, you know, like you'll take that to a geneticist and a geneticist will fill it out and a geneticist will say, yes, I'm currently diagnosing you with the hypermobility Ehlers Danlos type. But it is, if you go look at that, you have to have a certain score on the Beighton scale. You have to have like certain criteria met, like do you have papules in your heel? Do you have a certain type of scarring? Is your skin stretchy? Do you have velvety skin, meaning when you touch it? Like if you touch my skin, Austin's touched it before, my skin literally feels... No, I haven't. My skin literally feels like velvet. It is very weird. Yeah. Like it's an odd feeling. But you have to go through all of these criteria, have pain for a certain number of years, or, you know, have frequent joint dislocations and stuff like that. And you have to meet all that criteria to get that diagnosis. Yeah. So someone on the internet who is claiming that they have Ehlers Danlos syndrome, but probably didn't actually go through the diagnosis process, it's just unfortunate. And I hope that you don't take advice from people who actually aren't diagnosed with it. But I also want everyone to understand that there are people that do have this condition and it is very, very real and it is debilitating. And the majority of us out here are not pretending.
Yeah, I have absolutely no words for someone who fakes a disability for attention or for some sort of benefit. I really can't wrap my mind around the fact that someone would fake an illness with the intent of benefiting from it, because I don't think we've ever benefited from EDS, have we?
It's not beneficial. No. And like I said, for someone who really has it, like this affects your life so much. It's some days my pain's so bad that I have to use a cane when I walk. Nobody wants that. Yeah. Like a cane might seem fun in the beginning, but the looks that you get out in public when you're a young person who looks healthy using a cane, having to explain what's going on with you is frustrating.
Everyone assumes it's an injury, like you hurt your knee or something.
Yeah, and it's so hard because you just kind of want to go out and live as normal of a life as you can. Yeah. And I don't know why anyone would even want to like pretend that they have a condition like this, because who wants to walk around all day in pain or feeling like they're going to pass out or having to see 12,000 doctors all the time? Like, it's not fun. There's nothing that's glamorous about having Ehlers Danlos syndrome. There's nothing glamorous about a disability.
Yeah, referring back to the picture that social media can sometimes falsely paint. I think a lot of people who glance at your social media and see you doing so many physical things so well probably don't realize that our home essentially looks like a physical therapy clinic. We have a wheelchair, we have a walker, we have like 4 canes, we have SI joint braces, you have knee braces. What else?
I don't know. I'm sure
we have more. Therapy bands. We have lacrosse balls. Like, heating pads. Like she's like a lizard. Like, turn on the heating pad on the couch and she says, stay stuck to it.
Put me on my heating pad and I'm happy.
Yep.
Happy lizard.
More medications than a pharmacy probably carries. But that's the reality of what it looks like at home versus what people see out in public.
Yeah, it's definitely a different lifestyle. And like I said, social media is usually used to paint the picture that you want the world to see. And for the longest time, I didn't really let the world in when it came to disability because I was worried I would be judged and still am. Like, it does suck to be judged for something that you can't control. And like I said, be told, well, you're not disabled enough, or, you're too disabled, or, like there just is no way that you can please everyone on the internet. And I think it took realizing that for me to be able to share my story and hope that it reaches other people. And I hope that things that I say, even if it resonates with just one person, that's really all I care about. Like the other day I made a post about being comfortable using your cane in public.
Yeah.
And multiple people had messaged me and were like, thank you for putting into words what I couldn't. Those of us with disabilities often struggle with the way that we're perceived by the rest of the world. And I can't tell you how big of a deal it is to go out in public with a cane for the first time. It is stressful. It's terrifying. You're worried the entire time of what people are going to think, what people are going to say about you. And once you do it frequently and you just get used to it, it's just a part of your life. But it's interesting to connect with other people and realize that that's an experience that we all have.
Yeah.
And being able to connect with other people who are maybe a little bit further along in the accepting your disability process is great. It's great to be able to connect with other people.
Wow. Well, not that it was possible to summarize your EDS experience into like a 30-minute conversation, but I think that was a lot of useful information.
I think so.
We will absolutely have follow-on conversations regarding Ehlers Danlos Syndrome. I look forward to interviewing you in this way.
Yeah, entertain me.
There's so much that we didn't get to talk about, like how your family has recognized that they now have EDS, and that there's a very female prominent component to it. I would love to pull up some numbers next time. This conversation was off the dome because I know that you're intimately familiar with the details of this disorder.
Yes.
But because EDS is becoming so increasingly prominent and because awareness is finally coming along, the amount of research happening right now is pretty incredible, especially compared to like 10 to 15 years ago. It's
getting so much better. If you look into Ehlers Danlos Syndrome, you will actually find, and this data is out there everywhere. This isn't a statistic that I'm making up. Ehlers Danlos is the most under-researched disability currently.
Wow.
It's just something where, first things first, people didn't realize what was going on. And then, now had this classification of this connective tissue disorder, found that there were 13 different subtypes, and have isolated the genes. You know what I mean? Like, genetics is relatively recent in our history.
Yeah.
And so trying to isolate and figure out where these mutations are happening is something that just takes time. And they are actually finding that Ehlers Danlos Syndrome actually isn't a rare disease. It's just under-researched and underdiagnosed.
Okay.
I think a lot of us still like to classify ourselves as zebras because it is still so underdiagnosed that it is considered rare, but they actually think the prevalence is significantly higher than they originally thought. And it's actually not considered a rare disease. It's just severely underdiagnosed.
Fascinating. Well, we appreciate everything you shared with us today. That's going to be it for now. If you have any questions for Kayla regarding Ehlers Danlos Syndrome or disabilities in general, the problems that she faces every day and the solutions that she has for those problems, you can reach out to us at pbprogresspodcast@gmail.com. I messed that one up last time. To be clear, it is pbprogresspodcast@gmail.com.
We finally got the email down.
Finally got it down.
Look at us. It only took 3 episodes.
I've been practicing in the mirror. That's all for now. Thanks.